We're going to show you some shoulder screening techniques. This is probably the best investment you could make if you've got about 10 minutes of time, maybe even less than that, on somebody you're getting ready to train. Now let me make one thing perfectly clear. This is not an evaluation or an assessment. I will use some of these techniques with a patient sometimes, but if somebody comes to you and says, I'm already in pain, my shoulder's killing me, can you help me out? This is not a situation that you would bring a screen to. A screen is something where you're looking for a problem and hoping not to find one. If they already present with a problem, refer.
So when you're looking at somebody and you're getting ready to train them, that's where that history comes in, and you don't skip the process. You got to find out, and if they report pain, it's a referral. You know, you're working with a bad link. So go ahead and get some help, make sure there's nothing funny going on. Then you can screen. Why screen?
Well, first of all, they may not know they have a problem and still have one. So the screen may produce a problem that neither of us was aware that existed. So you're feeling fine, shoulder's pretty good, but you've been very, very inactive, and now you want to start training. If the screen uncovers a potential problem, I got to refer that too. Now, before you freak out and panic, you're not getting rid of every shoulder that comes to you. We're just trying to show you there are potential underlying problems that will not respond well to exercise if not diagnosed first.
And then once you screen and you've found out either they have pain and need to be referred, or you can go ahead and screen them and you find that weak link, you look like you're pretty smart and you just saved a lot of time and anguish in your training.
You do. Many improper training techniques will come to you, some very strong, some muscle imbalance, some overdeveloped, some tightness, some weakness problems. This is going to show you where that weakest link is. That's what we talk about all the time. The weakest link rules the chain. So some people are going to come to you and it's going to be a blaring mobility problem with the shoulder. Mobility strategy. It's going to be a blaring stability problem. Posture problem, breath problem, grip problem, and
Joint
so on.
Joint position problem, yeah.
Well, let's start with the neck. A neurologic problem in the neck is probably going to refer a lot of issues to the shoulder. When I say neurological problem, I mean nerve root pressure from a disc, spurring in the neck, previous arthritis. I don't want to find any of that. I may find a stiff neck, I may find a painful neck, and that too could be a potential shoulder problem, especially when you're doing overhead or upper body training. You may want the eyes on the hand or something like that. Now you've involved the neck in an exercise without even screening the neck first. So we're going to start with the neck, and what I'm going to do is run Brett through just a few simple neck screens. This is not a neck evaluation. I'm looking not to find a problem here. I'm hoping not to find a problem. Turn to the side, Brett. And what I want you to do is keep your teeth together and bring chin to chest. Good, all the way down. And now look all the way up. Try to get your face parallel to the ceiling. Perfect, excellent. Turn your back this way. Now, I'm going to have you also turn your head and try to bring your chin to your shoulder as far as you possibly can, and we're looking for symmetry left and right. Go the other way. Perfect. If none of this presents an issue or has a significant limitation, you've basically screened out the neck, and it's not going to interfere with a lot of the shoulder things we're going to show you how to do. Now, let's borrow one from the functional movement screen. Do that backward clasp with both fists, and look at the potential distance we've got right here. I don't care how stiff you are, at least be symmetrical. That tells me we're dealing with the same shoulder and the same T-spine on each side. If we see huge asymmetries here, we could have an imbalance and we could have a T-spine problem. So we want to check that as well. Now, lastly, I want to check you for an impingement sign. An impingement sign means I'm getting a piece of the rotator cuff, the supraspinatus tendon or a subacromial bursa. Basically, the joint is not tracking well and it's causing an impingement. This, if you bring it into exercise, is always going to end bad. No good could come of this. What I'm going to have Brett do is place his palm firmly on his opposite shoulder and now point his elbow as high as possible. I don't care. This is not a range of motion test. I'm not looking for optimal shoulder angle here. I just want to know, does that hurt?
No.
Okay. If that doesn't hurt, I take the arm and horizontally adduct it. Little compression right there. And if he's got some arthritis or a problem in the AC joint, it might be painful there. These are all things that we don't want to see a problem with prior to training. Okay, other side. And lift up. No problem there.
Nope.
And let's take it across. And there you have it, the first part of the screen.
Next in the screen, we're going to get a baseline for the grip, and we're going to evaluate how you're breathing. So for the grip, we got 3 strategies that we can use. We can go low tech, we can go moderate tech, or we can go high tech and use a hand dynamometer. If you're training a client at home or you're a personal trainer and you don't have a grip dynamometer, you can still evaluate grip strength by using the old finger squeeze method. So I'm going to have Gray grab both my fingers and squeeze hard as he can. And what you're looking for is, was there a difference between right and left side? And actually, you had a little bit of weakness on your left hand. Okay. So that's something that we're going to note and keep track of. The next tool that we can use is a gripper. This is the Iron Mind Captain's a Crush gripper. Very well made. They had come in a variety of strengths so that you can evaluate almost any client depending on what level gripper you give them. So I'm just going to give this to Gray. I'm going to let him get it set in his hand, and he's going to give it a squeeze. And if he can get those handles to touch, that's a full squeeze. If he's off by a ½ inch, I note that he was off by a ½ inch. And then we're going to compare that from right and left side. And then if we had the fancy grip dynamometer, I could get an exact measurement in pounds or kilograms with his grip. Why is testing the grip important? Because if you've got a restriction up here neurologically, in the neck or in the brachial plexus in the trap area, it's showing up down here in your hand, and you're only as strong as your hands. The other area that we're going to evaluate right now is the breath. How is he breathing? So the first thing I'm going to do is I'm just going to ask Gray to take a deep breath. And I want to see where that air went. And you notice that his chest rose. We shouldn't breathe like this, okay? The deal is your lungs extend from here to here. They're huge. And when you breathe up into the chest, you're using about the top third of your lung, leaving out a lot of capacity and not utilizing the rib cage, thoracic spine the way it's supposed to be used. So what I'm going to do is I'm going to have Gray take his fingertips, find the edge of his ribs, and really almost try and get underneath the ribs. Now when you breathe in, you should push those fingers out, showing that he's using his diaphragm. What most of your clients and patients will do, however, is you'll get them in this position and you'll say, go ahead and take a breath, and they'll go ahead and breathe up into their chest again. They don't know how to breathe down. We're going to show you how to do that here in just a minute.
I want to add a little clarity to what Brett said about the diaphragm. I think it's grossly overlooked, and we see a lot of shoulder and neck problems as a result of poor breathing mechanics. Imagine all day long if you're using shoulder muscles, traps, and neck muscles for respiration. Then when you go to reach overhead or lift or exert yourself in some way, these muscles that should be movers of the shoulder have been working all day just to get breath in and out of your body. Not having that diaphragm work for you can probably be one of two problems. Number one, diaphragm doesn't activate. It's got some amnesia. It's just not working well. Number two, diaphragm can activate because you've got a significant mechanical, or better word, mobility problem in the thoracic spine. Now, if you perform poorly in that backward reach that we did, or if you perform poorly in the diaphragm test, what I want you to do is take note of thoracic spine mobility and symmetry, meaning left and right rotation should look equal to each other. We want about a 45-degree turn of the shoulders, if not greater. And if I get Brett, if you take a seat right there. Now, I'm going to have you lay the stick across the collarbone, really hug it close, cross the arms, and the stick should be touching the anterior part of each shoulder. And what I'm going to ask you to do is just turn to the left as far as you can. But I want to make sure this motion is coming from the thoracic spine and nowhere else. So what I'm going to ask you to do is let's pinch this medicine ball here, and your feet are touching each other together. Now what I'm going to have you do is now rotate as far as you can. Note any discomfort or pain, and I'm just going to take a gauge, and he's right past 45 degrees. Acceptable. Let's go the other way. A little less motion, but definitely within limits. So I'm going to basically pass him for this test. Let's see what would happen if I saw something that alarmed me. I may see motion like this in one direction, and I may see motion like this in another direction. People usually like to try to make themselves symmetrical though. So instead of him just showing me an honest restriction, he may side bend, backward bend, or something to try to get that stick there. So I am to keep him right on line on the spindle. Okay? The next test we're going to do is going to require him to lay on his stomach, and I want to do a prone press up. This is a classic movement that goes back as far as the beginnings of yoga. But what I'm doing it for is, number one, to assess the lower back and any discomfort in the low back in extension. If I have an extension problem, I've probably got a problem somewhere with the lat, the deep lumbar fascia, the lower trap, and some of the stabilizers. It could also be indicative of a low back pain, but dysfunction here is a foundation for dysfunction up here. The second thing I want to see is, does loading the shoulder in a prone press up hurt you in any way? Good. Come on back down. So these are two tests that further give us clarity to some of the other stuff that we did. If you just took the reaching behind the back test and said, oh, we got tight shoulders, let's start stretching the shoulders, you may have missed the underlying cause of why those shoulders are behaving that way. In my book, Athletic Body and Balance, when people do poorly on the shoulder mobility or T-spine rotation, we basically take you right to thoracic spine mobility first, and all of a sudden the shoulder mobility gets significantly better. In our functional movement screen, where you score at 3, 2, and 1, stiff shoulders, usually 50%, if not greater, of that restriction is locked up in the thoracic spine. And remember this, if the goal of shoulder training, shoulder rehab is scapular stability, if you don't have thoracic spine mobility, the stabilizers don't have a good attachment point. They can't orient themselves to their anchor, which is the rib cage, to function normally.
Now we're going to confirm the breath, and we're going to try the push-up so that we see how the shoulder handles load. One thing real quick on what Gray touched on about the thoracic spine and its interplay with the shoulder and the scapula is with the diaphragm and the intercostals of the ribs, when they expand and contract to create room for the lungs to move air, that expansion, contraction maintains mobility of the thoracic spine. It really lubricates and moves this area the way that it's supposed to move. That interplay and that expansion, contraction, and movement of the thoracic spine is integral to the shoulder. And that's why breath is one of the secrets of the shoulder, and it's something that we don't focus on. But it's why we screen for it, and we want to see this cleared up, because once this thoracic mobility returns, that shoulder is going to function a lot better. Scapula can do what it was meant to do. You're stuck here. Scapula's got to do twice the work. So we want to open this up. Breath is one of the quickest ways to do that. I'm going to have Gray put his head on his hands. Real comfortable position. In yoga, this is called crocodile breath. So in the crocodile breath position, what I'm going to have Gray do is I'm going to have Gray sniff air in through his nose. And what I want him to feel is I want him to feel his belly push out against the ground. So he's got a great feedback mechanism, the ground. If he breathes in and he doesn't feel his belly push out against the ground, he's not breathing correctly. So he's got an automatic feedback. I'm not sitting there telling him what to do. The ground is giving him his feedback. So go ahead and sniff some air in, Gray. And look at his low back move. The diaphragm, when it expands and moves in order to create room for the lungs to fill with air, it pushes into that abdominal cavity, and we create movement down here. So I want to see the low back move. I want to see he wants to feel his belly push into the ground. I want to see his low back move some, and I can even take my fingers and stick them in his obliques. When he breathes in, my fingers get pushed out. Pilates is, they always tell their students to get wide. They want to feel the breath expand sideways. This is a great way to get that feeling. When you can crocodile breathe for 5 minutes, you're going to have retrained your diaphragm to a great degree to help you breathe better, and it's going to make a big difference for your shoulder. So now that we've got Gray breathing, we're going to get him into a push-up position. First, can he hold this position? And here in a few minutes, we're going to talk about winging versus sticky scapulas, and we're going to clear that up. But we want to take note of scapular position. We want to take note of whether he sags here. We also want to just note if pressure causes problems with the shoulder. And then if he can, we're going to have him drop into a push-up and extend back up. So we're going to check his form on the push-up. We're looking for pain. We're looking for problems. We're looking for sag. If you have a client that can't do push-ups, let them go on their knees. They're still going to load their shoulders. Let them do a partial press-up. And if this still causes problems, get them to an elevated push-up position.
That's a screen for you, and I think there's a lot of information there. You can run with that. Take what Brett said about the diaphragm. If you find that somebody's use of their diaphragm as a primary breathing muscle is severely limited, then the best warm-up, the best movement prep you could do with them is a crocodile breath. That's 5 minutes he was talking about. We spend 5 minutes doing that, and if you think, oh, well, I got to stretch the hamstrings, I got to stretch the calves, we got to work a little bit on that T-spine, we found some problems there too. If that's not the weakest link, and you're taking somebody on an exercise program effectively breathing through a straw, because that's what it feels like when you can't breathe. You just don't know what that feels like because you're probably using your diaphragm. They're not. then that is the warm-up. That is the movement prep. That's the most important thing you're doing for the entire exercise session. They may feel for the first time themselves get into a different exercise range or a different exercise volume simply because of that.
And it's that breathing, that missing link, that secret that really opens up this thoracic spine, gets the diaphragm moving, gets the intercostals moving, because where's your shoulder blade sit? Sits on your ribs. It
Right.
sits on those intercostals. It needs that movement, that expansion, contraction to really get it moving properly. So once you've got the information from the screen, you know what their grip is, you know if they've got a difference from right and left, you've evaluated all of these things, now we know where to go with the shoulder.
Absolutely. It's basically like your compass. And when dealing with a shoulder, the absolute most mobile joint in the body, lots of things have to work together to achieve stability. Remember, a lot of times people who appear strong in the shoulder are simply stiff, and they've learned how to use that stiffness. That's not what we're trying to promote here. We want a very, very mobile shoulder that can suck itself in and hold push-up position, do an effective pull-up, do an overhead press, handle almost a push-up with a clap in the middle for a throwing athlete. That's almost unheard of sometimes, and yet all my throwing athletes, I'm reluctant to not say, let's do a push-up with a clap in the middle. If they can't handle that stress, I don't know if I want the arm going 80 or 90 miles an hour through space.
Let's find out what they can do, screen it out. We know what the weakest link is. We strengthen it. Now we got a better athlete.
Excellent. Well, we want to take you through some remedies for some of the screens we've done. Use these to complement the workout you're already doing. We're not giving you a whole workout here. We're showing you a few pearls that you can slide right into those upper body training programs, specifically for the shoulder, to really boost the program that you're already doing.